Good morning, everyone. So today we'll be discussing about casting and investing procedures. The topic will be discussed under the following contents: introduction, steps in casting, what's a die spacer, wax pattern fabrication, screw, general principles of screw former, casting ring liner, and casting ring, investing, burnout, casting machines, cleaning of casting defects, review of literature, finally, conclusion and references. So chapter mainly focuses on the laboratory procedures before we fabricate a crown. What are the steps involved in fabrication of a final crown? First, initially, we will be doing a tooth preparation. Tooth preparation is needed only if a patient's tooth is RC treated or a discolored tooth, or if a patient complains of missing tooth, single or multiple tooth missing. Such cases, we will do the tooth preparation. Initial steps is tooth preparation. Once we do the tooth preparation, we'll make an impression. The next is impression will be poured using appropriate material. Usually for fabrication of crown and casting procedures, we have to follow. So we will be using a die. Usually we will be using type 4 and type 5 die for pouring the cast. Next step is cutting out the individual tooth. With the prepared tooth, we will be cutting it out. That step is the individual prepared tooth. It's called a die. We'll be discussing about it in further coming slides. So next step is after pouring the cast, next step is fabrication of wax pattern. Next is screwing the wax pattern. After screwing, we'll invest the whole wax pattern in appropriate investing medium. Next step is once the investment is set, we'll be doing the wax elimination. After wax elimination, there will be a mold space created into which we will be pouring the molten metal. Appropriate metal will be pouring. Next is recovery of the casting and evaluation of the casting. So before we move on to the detail about this chapter, we will be discussing few of the key terms. First term is burnout. It's a process of heating an investment mold to eliminate the embedded wax or plastic pattern. Next term is divesting. It's the process of removing an investment from the casting or fortress ceramic. Hygroscopic expansion, it's the amount of setting expansion that occurs when a gypsum bonded casting investment is immersed in water. Next, we have refractory. What's a refractory? It's a material capable of sustaining exposure to a higher temperature without any significant degradation. Next, we have screw. Screw, it's a mold channel through which molten metal or ceramic flows into the mold cavity. Next, we have screw wax pattern. Wax form consisting of prosthesis pattern with attached screw network. Next, we move on to the definition of casting. A casting is defined as something that has been cast in a mold, an object formed by solidification of a fluid that has been poured or injected into a refractory model. Casting is a process by which wax pattern of prepared tooth is fabricated and converted to its metallic replica. According to Rosenstein, casting, it is the process by which a wax pattern of prepared tooth is fabricated and it is converted to its metallic replica. Next, we'll discuss a few things about lost wax technique, which was introduced by Taggart in 1907. Lost wax technique is a casting of metal alloy or ceramics into a mold produced by surrounding an expandable pattern with a refractory slurry that sets at room temperature, after which the pattern is removed through use of heat. So surrounding medium is the investing material which we use. It can be the gypsum bonded investment, phosphate bonded investment, depending upon the type of casting which we are using or the temperature which we are giving the material. Next, the expandable material which we refer here is the wax or the mold wax pattern which we have created. Next, we have a dye. Dye is a positive reproduction of form of a prepared tool in any suitable substances. So dye, there are some few ideal requirements for the dye. The dye which we use, it should be having accurate reproduction of fine detail. It should follow the fine details or the impression which you have made. So whatever is there in the patient's mouth, that exact replica should be there in the dye. So the importance of impression material as well as the dye is necessary. Next requirements of a dye is dimensional accuracy. Next, we have good strength and hardness. It should be abrasion resistant and should be having a greater strength. Next, we have ease of use. This should be easily available, and the use also, the mixing, everything should be easily done. Next, we have abrasion resistance and relatively inexpensive. The material which we use in dental procedures, most of the material should be inexpensive, then only it can be afforded by the patients also. Next, we have move on to how we increase the abrasion resistance of a dye. Though we are using a higher, greater resistant dye, dye with a greater strength, we can increase the abrasion resistance of the dye which we already have. That's there are 3 to 4 ways how we increase the abrasion resistance. Coating the surface with a dye hardener. Second is substitute colloidal silica for water. Third one is treating surface with resin. Usually you'll be using cyanoacrylate, polyester or epoxy resins. Fourth step is impregnating acrylic resin to dental stone. Next, we move on to dye spacer. Dye spacer is usually a material which we coat or apply onto the surface of a single tooth dye. Usually the means or the use of dye spacer is it gives space for the cement. While final cementation, the dye spacer which will give space for the cement which we are using to fix the crown in the patient's mouth, or the cement crown in the patient's mouth. So the thickness of dye spacer may vary from 10 to 30 micrometer depending upon the cement which you are using. We have to select the dye spacer. Examples of dye spacer: resin, which is most commonly used dye spacer. Next, we have model paint. Next, we have colored nail polish, thermoplastic polymers dissolved in volatile solvents. So while application of a dye spacer onto a dye, we will be always applying it in a single stroke or in a one direction motion. Once you apply one coat of dye, we have to wait at least 2 minutes before applying the next coat or the second coat. We have to wait for the first coat to dye. And the dye which you are applying or the dye spacer which you are applying, it should always be 0.5 to 1 mm short from the margin. Next, we have wax pattern fabrication. We'll discuss about the fabrication of wax pattern. Wax pattern fabrication is nothing but the contouring of the wax pattern into desired shape and using inlay casting wax foam. Shortest time should be elapsed between time the pattern is removed from dye and the time is invested. So while wax pattern fabrication, what we meant is, if it is a full metal crown, we'll be the wax pattern which you fabricate, it will be exact shape of the final crown. If you are fabricating a wax pattern for molar tooth, we'll be fabricating exactly the shape of a molar tooth. If it's an anterior tooth, we'll be fabricating the wax pattern exactly the shape of a anterior tooth. Whichever tooth is missing, the shape of anterior tooth will be recreating. If you are fabricating PFM crown, if you are fabricating wax pattern for PFM crown, we usually do a coping. That is a smaller version which just covers the prepared tooth, and on which we will be coating the ceramic and process it later. So there are different steps of fabrication of wax pattern. The first one is direct method and second one is indirect method. First, direct method is usually we do the wax pattern fabrication in the patient's mouth itself. The wax which he uses, mouth temperature wax or the type 1 medium wax we'll be using. This is steps is usually used in case of inlay wax pattern fabrication. Second method is fabrication of wax pattern in the laboratory. That is, we call it as indirect method of wax pattern fabrication. The wax which we use here is type 2 soft wax. It is most commonly used technique. Usually it is done outside the not in patient's mouth. Usually it is done in the laboratory. After tooth preparation, we'll make an impression, pour the cast, make a dye, and in the lab, we will be creating the wax pattern, not in the patient's mouth. Next, we move on to screw. What is a screw? Screw is part of casting that acts as a channel for molten metal to flow through the mold cavity after the wax has been eliminated and compensate for alloy shrinkage. So screw is nothing but a space through a channel through which the molten metal can flow into the mold cavity after the wax has been eliminated. So there are screws classified into based on material. It is classified into metallic and non-metallic. Non-metallic screws can be plastic or wax screws, and basic attachments are direct attachment and indirect attachment. There are two types of attachments for screw. That is, one is basic attachment and second one is first one is direct and the second one is the indirect attachment. So there are general principles of placement of screw. There are certain ways, or the positioning of the screw is very important in casting procedure. There are different ways, or the what we say positioning of the screw is very important in casting. So when we talk about positioning, the screw should be positioned in the bulkiest portion of the pattern which we have fabricated, especially in the non-functional cusp. Also in the bulkiest portion, we will be attaching the screw. That's how we position the screw. Next is the angle by which we attach the screw onto the wax pattern. It should be always 45 degrees to the wax pattern. The screw direction should be always 45 degrees to the wax pattern which we have fabricated.